Several studies conducted along the shores of Lake Victoria have indicated a high HIV/AIDS prevalence rate among fishing communities in Uganda. Researchers from a program that deals in HIV called the Knowledge Management and Communications Capacity sampled 12 learning sites to establish the prevalence of HIV among the fishing communities. The prevalence in one of the learning sites in Kalangala was at 42.3%, which is much higher than the national average of 7.3%.
Fishing communities, because we realize this is a group that we've known has had a heavy burden of HIV for over 30 years, yet still is very, very underserved.
The research sought to establish why the prevalence rate among fishing communities remains high despite several interventions that the government and various organizations have made countrywide.
Condom use tends to be quite low. A number of sexual partners tends to be quite high. So a lot of the things that we know are drivers of the epidemic are happening in these communities.
The fisher folk are considered a population at risk because of their lifestyle.
But you can find some communities at 15% and some going over 40%.
They also rode on previous secondary data that was already in existence to carry out this study. The first HIV case in Uganda was identified in 1981 at Kasensedo landing site in Rakai district.
We found that there are many women and children that are also underprivileged and in desperate positions in these communities, and that the health response was very limited.
The chairman of the Parliamentary Committee on Fisheries, Dr. Michael Lulumebaega, advises that there needs to be a sustainable multi-sectoral campaign in order to roll back the situation of HIV/AIDS in such communities.
They are underserved because many of them don't even see health workers. If they happen to see health workers, they cannot be as helpful as they should be in providing for what can be used to alleviate a situation of HIV and AIDS.
The Ministry of Health estimates over 940,000 HIV/AIDS related deaths since the onset of the epidemic in Uganda by 2011. Gertrude Tumusime with Kware, NTV.